Good morning, everyone. I am Melissa Seifert, the Associate State Director for Government Affairs for AARP Michigan. I want to thank you all who are in attendance today. We have some very important content to get in front of you regarding veteran benefits and how to use all these benefits with your benefits that you've earned through your service, your healthcare benefits. I want to first and foremost thank everyone for their service on this call today. Your sacrifice has really been much appreciated across the board, and AARP just wants to take a minute to thank you all for all that you have done for us. So without further ado, I don't want to take a long time with my part of the presentation. I really want to get to this really important content. So up first, we have David Sevier. He is retired from the U.S. Navy, where he developed health policy for the Secretary of Defense and U.S. Congress, including the military's health system TRICARE, a $15 billion program for over 9 million individuals. David subsequently assisted developing countries to build their national health systems as part of the U.S. State Department. He later created a Washington, D.C.-based think tank to conduct policy research and recommend changes to federal health programs. He later directed a federal commission to create a 20-year health plan for the U.S. Department of Veteran Affairs. We are beyond thankful to have David here today to talk about AARP's Healthcare Navigator. So thank you, David.
It is a great pleasure to be here, Mel. Thank you very much. And let me also just express my gratitude for all of the veterans that are on this program. I don't know how many of you are there, but it's great to be able to speak to you about what the benefits are that the Congress and the U.S. government have provided, and just share with you some of the experiences that I have had, and will be able to relate to you in terms of how to get your veterans benefits. So as Mel said, I've had an interesting career. I had the great opportunity to help create the TRICARE program in the U.S. Department of Defense. That was some years ago, and it's still around today. And so that is the U.S. Department of Defense. In order to qualify for benefits for that, you have to have retired from the military. And so there's that. And we know that there are a lot of AARP members who have actually gone through an entire career in the military and have retired, and they are eligible for TRICARE, or when you turn 65, TRICARE for life, as it's called. And I happen to be one of those people and my family, so that's a great thing. But there are many, many more people who have been veterans. In other words, you have served at least 180 days in the military or the uniformed services, and have eligibility to have your benefits that would come from that. You do have to apply for them, however, and I want to be able to just mention that it's important to get the background that is critical for you to be able to apply for your benefits. And I'm just going to hold up here. I tried to see what it would be like to actually get my DD 214, as it's called, and I had to send off to the National Personnel Services Record Center to receive my most recent DD 214. DD 214 is this document right here. It says this is what I did in the military and where I served. So those are important documents for you to have. I want to see if Karina could put up the first slide, however, and just express to you how much we appreciate the fact that AARP, with its almost 6 million veterans, has supported veteran benefits for a number of years now. And this document, the AARP Veterans and Military Families Health Benefits Navigator, is something that we had the privilege of being able to put together a couple of years ago. This is the most recent version of it, and we have created a new version for the last couple of years. This is the Health Benefits Navigator 2.0, as we call it. It has some updates for this year that include specific information that you can obtain from that navigator. It's about a 32-page document. Let me ask Corinna to put the second page on there. And it talks about why this navigator is so important. Well, it's important because you have earned benefits that the military and the Department of Veterans Affairs have provided for you. You do have to seek them out, however. You can't just access those benefits if you're a veteran automatically. You have to be able to ask for them, and that's why I highlighted the ability to go after a DD 214. That is a critical piece of information that you have to obtain to be able to gather and organize your benefit package. So that's why this navigator is so important. We also were very concerned with how people that might not think about how to get your benefits can go about it. And it might even be that you don't know how to do that, and your family members have to go after your benefits for you. So what we put into the navigator were some case studies so that you could get an example of what it would be like to go after a particular benefit. So in this case study here, this is part of the navigator. We pointed out the fact that here's somebody, this is just a notional person, but we said, all right, I served in Desert Storm. I got out after 6 years. Now I need healthcare benefits. I'm currently 52. I got laid off last year. I never thought I'd need to go to the VA for healthcare, but now I don't have any other insurance. So this is what I need to do. And there are a whole lot of specifics that the navigator points to show you how to get your benefits. So thanks, Corinna. Thanks for putting those 3 slides up there, and we can go on to live at this point. Let me just mention one more time that there are 2 different categories that you can be eligible for particular benefits. One is through the Department of Defense, the military, and you have to have retired from the military to get those when you're my age or at a certain age, or you can go to the Department of Veterans Affairs, and the navigator specifies what the difference is there. But you can go after your VA benefits through a whole lot of different avenues. Each state has a Veterans Affairs office. They have veteran service officers that can help you. Your congressman and your senator have individuals who are able to help you with your qualification for benefits. Even counties have veteran service officers, And then there are also a number of veteran service organizations. Think about the American Legion, the VFW, the the Disabled American Veterans, the Vietnam veterans. There are dozens and dozens of organizations who have qualified veteran service officers who can help you advocate for your benefits and demonstrate how you can get them. Now, you have to have had a qualifying event, but the VA has many, many different categories in which people can qualify for those benefits. So don't assume that you can't get them, assume that you can. And what we want you to do is use this navigator to obtain the information that's necessary so that you can go after your benefits. So I think that's all I'm going to say at this point. It's an important area for us to look at. I had the opportunity to both work on the TRICARE side in the military, and then also in the VA. I led a commission that was looking at the future for VA healthcare, and I appreciate both of them. And it's an important thing for everyone to understand that we have benefits. And if you're a family member, a daughter, a son, a wife of a veteran, you can also help that veteran get their benefits by using that navigator and looking at some of the case studies. So thank you very much, and I'll give it back to you, Mel.
Thanks, David. And I just want to reiterate, this is one of the things that we're bringing to you here today is more information on how all of these benefits connect with each other, whether you have TRICARE, private insurance. We have somebody from the Medicare Medicaid Assistance Program going to be chatting with you about open enrollment for Medicare and what that looks like, and playing with all of your different benefits that you may have. But up next, we have Brenda Wiechek with the VA. And she's with the Veterans Affairs Medical Center out of Ann Arbor. And Brenda is the facility revenue manager there. And she's going to talk to us a little bit about VA benefits and how those play with all of the other healthcare benefits that we've been talking about today. So Brenda, I'm going to have you come on and share some more about yourself and your expertise and all the information that you have.
Good morning. Thank you, Mel. My name is Brenda Wiechek. I'm the facility revenue manager here in Ann Arbor. I've been with the VA for 22 years. Most of those years were spent in some sort of revenue function. So I have a vast background in all things revenue as it associates to directly billing either the veteran or billing their insurance. So the first process for the VA is to register with the VA. Every veteran that registers with the VA is assigned a priority group. Once you get that priority group assigned to you, that's what determines whether or not you're going to pay copays. There are copays related to medications, and it depends on the type of medication you get. True generics are $5 for each 30-day supply. Non-generic medications are $11 for each 30-day supply, and anything in between is $8 per 30-day supply. No matter which priority group you're in, though, one of your benefits is you're only paying up to $700 a year for prescription medications. So if you're on 10 medications, that could add up pretty easily. Some of our veterans stop paying in July, August, and September, and then it picks back up again in the following calendar year. Office visits, if you are copay chargeable, depending on your priority group. Basic visits are $15. Specialty visits, CAT scans, in and out surgeries, any specialty care, those are typically $50 copays. If you have an inpatient stay, that is the only charge that goes up regular every year if the Medicare Part B deductible goes up, because that's what we charge for an inpatient stay. Currently, that is $1,556 for day 1 to 90 for a calendar year. We do take insurance. We do bill private insurance. If you have Medicare primary and a supplemental insurance or a Medigap insurance, we'll bill the Medicare to get a remittance advice to send to the secondary or your Medigap. The benefit to coming to the VA and utilizing your insurance versus going to the private sector, if you have a copay with your insurance, that copay is valid at all times in the private sector. But when you come to the VA, if your insurance pays for your entire visit and covers your copay, we adjust your copay before we take money to cover the services that were rendered. One small benefit for being a veteran. If you receive a service-connected disability, David touched on that a little bit in getting in touch with a veteran service officer. That affects your copays as well. If you have a service-connected disability or what we call a special authority, Vietnam veterans, the biggest special authority is the Agent Orange exposure. We do look at medications and visits and if they're directly related to those. We don't bill you and we do not bill your insurance company for those. If there is anything that cannot be billed to your insurance company or your insurance company rejects or it goes to a deductible, we don't go back and offset you or bill you based off what the insurance company states you should have to pay. You're still subject to just the regular VA copay depending on your priority group. The only exception to that, David did touch on TRICARE for life. TRICARE has cost shares. Unfortunately, there's no way around that TRICARE. And if you want to utilize your TRICARE benefits, you have to check into your appointments when coming to the VA as a TRICARE patient versus a veteran. I would suggest that you do stop in and talk to somebody in the billing department. We have a very nice setup in our main floor of the hospital. When you first walk in, it's almost one-stop shopping. Our health benefits unit who enrolls veterans into the VA is there. We have our release of information staff who can get you medical records. They can actually get medical records either from or to your private sector provider as needed. You have the billing department, and you also have what we call travel pay. Depending on your situation, your income, your priority group, some of our veterans do receive travel pay for coming to their appointments. And you can stop in and ask any one of us. That's at the front end of our welcome center. The back end of our welcome center is some of our veteran service officers. We have up to 2, possibly 3 veteran service officers on site every day. And they will be happy to assist you in any claim that you want to file. We also have our patient advocates. If you are unhappy with any decision that we tell you, you can go to your patient advocate and they will actually get a message most of the time to the supervisors. In the billing case, it's me. And I will look to see if my staff, number 1, told you right. And number 2, if there's anything else we can do for you. Another benefit that the billing department has is you can ask for a repayment plan of any debt that you incur, or you can ask for a write-off of any debt. If, let's say you're working now and you're paying your bills, all of a sudden, you don't have a job, or, your spouse loses their job. There is a waiver process that you can fill out and complete and see if they're willing to write off your copayment charges. There is always assistance in paying your bill if if need be. And like I said, any questions that you have, my staff is always willing to help. I have staff in the office every day, at least until 3 p.m., some days till 4:30 p.m. And if you wanted to know anything else as well, my information is going to be shared on the screen, and how to contact me either via email or telephone call to either myself or my staff. One other thing about billing process is if for any reason you get medications and get a bill, first time veterans enrolling into the VA, our billing statements go out once per month. Today marks the end of our billing month at 4:30 today. Any billing or payments are stopped. Bills are prepped and they get mailed out on the 7th of the month. So it's not like the private sector where you go to pick up your medications and you pay for those as you pick them up. You do get a once a month billing statement and it goes over the last 30 days. So if there's any questions, please put them in the chat and we'll go ahead and be happy to answer those afterwards.
Thank you so much, Brenda. I mean, I'm sure a lot of you that are on this, I don't want to say call, but this virtual event that we're having today are seeing the bigger picture and how confusing all of these different programs play together. So Brenda, I so much appreciate you being here today to talk about the process of how you use your Medigap, your Medicare, and how those all play with VA benefits. And as Brenda stated, if you have questions, please use that interactive chat. We will get to those after all of our speakers. And so, like I said, we have a very robust program ahead of you today. So we have 2 more speakers. And I hate to use the cheesy terminology news you can use, but this program is really meant to give you some tangible takeaways, some power and engage that you can go to these different organizations and get the help that you need. I want to just reiterate, these are benefits that you have earned through your service and your sacrifice. We want to make sure that you are connecting with them. So that's why we are all here today. The next speaker that we have is Melissa Devine, and she's been with the Michigan Medicare Assistance Program and the Area Agency on Aging 1B for 5 years. During her tenure with MMAP, which is the acronym for Michigan Medicare Medicaid Assistance Program, she's been awarded Site Coordinator of the Year. Melissa believes healthcare is not a privilege, but rather a right. That's part of what drew Melissa to MMAP. Melissa works to educate and empower Medicare beneficiaries about Medicare so they can make educated decisions that allow them to have healthcare coverage without other lifestyle insecurities, whether it's food insecurity or homelessness. Support and advocacy are very important to Melissa, and we appreciate her so much being here today to share all of the information that she has around Medicare open enrollment, which is just around the corner beginning on October 15th. So Melissa, thank you for being here.
It's my pleasure. Thank you for having me. As Mel mentioned, I am with the Medicare Medicaid Assistance Program, and today I have some information on how the VA benefits coordinate with Medicare and the other opportunities that you may have in the civilian insurance sector. Let's go ahead to the next slide, if you don't mind, Karina. Perfect. So what can a MAP counselor do for you? Well, MAP counselors have been extensively trained and are certified. We are a completely unbiased program. We are a free service. And we are considered the state's health insurance program here in Michigan. But a MAP counselor can help you understand Medicare health plans. We can help you compare and enroll in your Medicare Advantage drug coverage if that's what you choose. We also can help you enroll in Medicare prescription drug coverage, so just those drug coverage plans. We can also help identify and report Medicare and Medicaid fraud and scams. We are the senior Medicare patrol in the area as well. But the other really important aspect is that we can assist with any enrollments into low-income programs as well. Next slide, Karina. So let's take a look at the insurance options. First up is Medicare. So Medicare is typically what we consider civilian insurance. It's health insurance for 3 groups of people: those that are 65 and older, those under 65 with certain disabilities, and those of any age with end-stage renal disease. It is administered through the Centers for Medicare and Medicaid Services, which is referred to as CMS, but an enrollment for most takes place through Social Security's administration. For those that were retired from the Railroad Retirement Board, then that would take place through the Railroad Retirement Board. There's 4 parts to Medicare, though. There is Part A, which is the civilian hospital insurance. So any hospital that you go to outside of the VA, you can use that Medicare Part A at. Part B is the medical insurance for civilian side. So that's going to be going to any primary care doctors outside of the VA and the TRICARE facilities. I do know that TRICARE has some locations in the big military areas. And then there's Part D, which is the prescription drug coverage. That's just the prescription drug coverage. So it would be utilized at the pharmacies only in the civilian aspect. And then Part C, which is your civilian Medicare Advantage plans. Those are the bundled plans. You're going to have the A, B, and D coverage in one plan. It's going to function like an HMO or a PPO, and you're going to have direct cost sharing with that. So if we go to the next slide here, we're going to look at how you can get your Medicare coverage. So typically when somebody first enrolls in Medicare, you have the option of going one of 2 routes. The first route is with Original Medicare, and that's going to get you your red, white, and blue Medicare ID card. It'll come from the Department of Health and Human Services of the U.S., not just Michigan, and it will provide you coverage for hospital and medical at the doctor's office. You then can choose to add a Part D prescription drug plan, and that will provide you the drug coverage at the pharmacy. And then you can also add on to it a Medigap policy if you choose, which was briefly touched on by Brenda. Those are the plans that will help offset the cost sharing that comes with Original Medicare. So that 20% coinsurance or that Part A benefit deductible, which Brenda mentioned is $1,556 this year for 2022. We do have 2023 numbers, but that's a different presentation we'll have to hop on to. Then you've also got the second route, which is getting the coverage through Medicare Advantage. That's going to roll all of A, B, and D into one plan. And you're going to have your own separate cost sharing. You generally get some extra benefits like dental, vision, and hearing. And from there, you can choose to change your plans during open enrollment. So October 15th through December 7th, let's say you hopped into a Part D plan this year, but you really want to try a Medicare Advantage plan. You're in luck. You actually can do that during open enrollment. It is every fall, again, October 15th through December 7th. We are everywhere in the state doing virtual appointments and in-person appointments to review what your coverage is with Medicare and make sure you're in the best plan for you based off of cost, medications that you may be taking, facilities you want to utilize it at, and more. If we can go to the next slide. So VA benefits, that's coverage in a VA medical center only. It does provide medical and mental health care, home health care, nursing home care, durable medical equipment, and some Medicare excluded items like over-the-counter medications and supplies. Those aren't typically things that you see covered by Part D or even sometimes Medicare Advantage plans. So that is a perk to the VA benefits. And we'll take a look here at the next slide. So when it comes to VA coverage and Medicare, you absolutely can have both. However, they don't coordinate together in the respect that you can just take your Medicare to the VA all the time or even the VA outside of the VA hospitals. The VA coverage is going to be for at the VA facilities only. It typically does not pay for Medicare cost sharing, deductible copays, and coinsurances. However, Brenda did mention there are some special circumstances where it will. But you can enroll in both and also have a Part D if you'd like. You cannot, though, use the Medicare special enrollment period to enroll into Medicare Part B after your 7-month initial enrollment period. So let's say you had VA coverage first, and then you were eligible for Medicare. If you want to have insurance to utilize in the civilian industry, you are going to want to make sure that you got Medicare Part A and B. A is typically free for most because It's what you've paid into Social Security all your life with a job. Now, if you want your Part B, you will have to pay a monthly premium for it. You also will have an annual deductible, but you only have a limited amount of time to get into that Part B. And it's typically 7 months. So it's 3 months before you turn 65, the month you turn 65, and 3 months after. If you do not enroll in your original Medicare during that 7-month initial enrollment period, you then have to wait to enroll during the general enrollment period and typically end up with late enrollment penalties, which we'll touch on in just a little bit. Now, when it comes to Medicare, you can absolutely use your Medicare at civilian healthcare facilities all across the state. Depending on what coverage you have, depends on whether it's going to be local or national. But it's not going to typically pay for VA cost sharing if there's any, except for under special circumstances. I don't have all those special circumstances to share with you today. That would definitely be a Brenda question, but we do know that there is some assistance there. You can enroll into programs to help pay for Part B premiums and cost sharing. That's typically Medicaid. And those would be like the Medicare savings programs. And we can assist you with those enrollments. You also can enroll again in the VA benefits and have Medicare together, or maybe started with Medicare and then ended up with your VA care. Either way, you can have both. They just won't coordinate together outside of a VA facility. So when it comes to the VA coverage and Medicare Part D, that next slide, again, you can have both, but typically they don't work together. You don't typically get to take your VA coverage to a civilian facility at a pharmacy and have them pay for your meds. Vice versa for Medicare Part D typically. However, if you choose not to take Part D coverage during that initial enrollment period or anytime after that, that's okay. You can choose to enroll in it at a later point in time. Having VA coverage gives you a special enrollment period if you want to make enrollments after that initial enrollment period or outside of the open enrollment period in October. Again, with Part D, you're going to utilize this with the pharmacies that are civilian pharmacies. You can have both, and sometimes you even get your Part D coverage through a Medicare Advantage plan or Part C program, which then you're going to be subject to, their cost sharing and copays. All right, so if we go to the next slide, this is going to be your VA coverage and Medicaid. Again, you can have both. They're not going to coordinate like we'd like them to, but Medicaid will coordinate with Medicare. So if you wanted to receive civilian care outside of a VA facility and you have Medicaid, that's going to be primary. And then, you're going to have Medicare primary, Medicaid secondary. So the Medicaid will coordinate with your Medicare. It will help with the cost sharing and the copays. But it's not typically something you can just take to the VA and have them process the insurance. So much like the other couple of slides we talked about. Now, if you do end up having Medicaid, so if you end up having those assistance programs for Medicare, it does help with late enrollment penalties. It also does help you avoid having to wait for general enrollment periods. It does usually guarantee you a special enrollment period into programs or coverage. So if we can go to the next slide, Karina. Medicare, in terms of coordination with Medicaid, is always going to be the primary payer for the Medicare approved services. Now, Medicaid is always going to be secondary or potentially even tertiary if there's a different secondary insurance outside of VA. But all services must be from a Medicare approved provider, and they must be services that Medicare will pay on for Medicaid to pick up. And Medicaid will always be the payer of last resort. So no matter what you have for your insurance, you're definitely going to have Medicaid pay last. But these MSP programs can get you all sorts of assistance. It can provide premium assistance. So if you have a Part B premium you have to pay monthly, it can help cover that. It can also help with the cost sharing, so the copays and the coinsurances. It can assist in making sure that you're not balance billed by doctors' offices and hospitals. And then it can also provide prescription drug assistance for those that are dually eligible, because it gets you an automatic enrollment into our low-income subsidy program through Social Security. And that specifically helps with the prescription drug aspect. It helps with the premium payment. It helps with the deductible and the copays, and even making sure that we have coverage during that coverage gap, or what used to be called the donut hole. All right, so I know we kind of touched a little bit on not being able to use the VA benefits for a special enrollment period into original Medicare Part B. So let's take a look at how the late enrollment penalty is calculated for Part B. If you do not have creditable coverage and you do not enroll in Part B when you are first eligible, and you choose to enroll during the general enrollment period, you will end up paying a late enrollment penalty. It is going to be added onto your monthly premium, and it will continue with you the entire time that you have Medicare coverage. Next slide. So the Part B late enrollment penalty is calculated on 10% of the base Part B premium. So for 2022, that's $170.10 per month. So it's going to be 10% of $170.10 for each 12-month period that you did not have Medicare Part B or creditable coverage. And again, creditable coverage is considered just as good, if not better, than Medicare. The penalty amount will change each year because the Part B premium changes. And just a little side note of excitement for everybody. Medicare has actually decreased their Part B premium for 2023. So that means the late enrollment penalty will actually go down just a smidge next year. All right. So next is just a quick word about Medicare fraud. Medicare fraud is definitely one of the most common schemes that is affecting Medicare beneficiaries. And it can be as simple as if Medicare or Medicaid gets billed for a service that you never received, or equipment that you received or returned, or maybe even equipment that you never received in general, like durable medical equipment. If somebody else uses your Medicare or Medicaid card for healthcare services and they're not you, that's a big problem too. Or even if a company uses false information to mislead you into joining a Medicare plan. We see that all the time during open enrollment period. You will get 1.5 million mailers sent to your mailbox. You will see 1.5 million commercials, and some of them are using celebrities for endorsements. And it's just really tricky because if you jump into those plans blindly and you don't take a look at what the coverage is, what formulary list they have for medications, and other items, then it can be misleading and make it hard for you to utilize your coverage. So it's always a really good idea before you just jump into a plan to really assess, and you can utilize MAP for that. Karina, if you don't mind, to the last slide for me. We are, again, taking appointments right now for open enrollment. So if you are at all interested in getting one, you can give us a call at our 800 number, which has been at the bottom of your screen throughout the day. You also can reach out to me via email. I did list that here on the slide for you guys. I'm happy to answer any and all questions that you may have Medicare and Medicaid and possibly VA. I'm not going to have as much as Brenda will have, so you may want to touch base with her first, but definitely on the Medicare and Medicaid end, we can answer any and all questions. And we are your best local resource. Again, we're not affiliated with insurance companies. We are completely unbiased and our services are free. So feel free to reach out to MAP. We're more than happy to assist.
Thank you so much, Melissa. Each step that we take through this, it gets more and more confusing. So I'm so glad that we're having these conversations about how all these insurances interplay, or if they don't, and the payer of last resort versus the VA benefits. So I just so much appreciate this conversation. And again, if you have questions specifically for any of our speakers that we've had today, David, Brenda, or Melissa, please put them in the chat. We want to make sure that we are getting you the information that you need to make the best decision about your health care moving forward. So again, put those into the chat so you can ask questions to somebody from the VA, to somebody from MMAP, and somebody who is an expert on the different types of insurances you can receive through your service. So thank you so much, Melissa. And then finally, last but certainly not least, we have a very exciting program to share with you for all of the veteran residents in Washtenaw County, and it's Rise at 50 Plus. So we have Rebecca Yachik, who works hard to serve the Washtenaw County as the Community Development Manager for Rides at 50 Plus program for Washtenaw County, which is dedicated to enhancing access to transportation options in Washtenaw County for older adults and underserved populations. Rebecca is tasked with working with transportation providers, community organizations, and riders to grow the Ride at 50 Plus program and provide an array of transportation services to those who are looking to get from point A to point B. So Rebecca is going to come on and share with you how you might be able to receive a free ride to a medical appointment, a veteran service officer, a VA, whatever you need. So she's going to share with us how this works, and hopefully you all can get a ride somewhere that you need to go. So thank you, Rebecca.
Thank you. And thank you to all of our veterans who have served for us, and your sacrifice is greatly appreciated, and we are here to serve you now. So I work for the ARP Ride at 50 Plus program, which, as Mel said before, is dedicated to enhancing access to transportation options in Washtenaw County for older adults and underserved populations. Next slide, please. So you may be wondering, what is the Ride at 50 Plus program? So we offer multimodal ride sourcing from several local transportation options, which I'll go over in our next slide. Although the service is targeted at individuals who are older adults age 50 plus, as well as underserved populations, anyone can use this program, and I will talk about that in a few slides. And then we provide multiple access points. So for our tech savvy folks, you can use our app, and then we also have an online platform. But if you don't feel comfortable using those, you can call our call center to set up a ride. One of the great perks about this program is that we're not going to leave anyone in the dark. We're going to provide training to all of users of this program, whether you're a rider, an organization, or even those who provide rides for us. We're here in the community. We've been here for probably a little over a year now, just ready to serve our community and get people connected from point A to point B. So the next slide, please. So I just want to talk about quickly the transportation options through this program. And so I'll start at the top and then go clockwise. So the first one is RideShare. So think Lyft or Uber. They are both accessible on our platform. And you can use those if you're looking for that on-demand service. We also have specialty transportation options. So if you have a wheelchair, you need that lift, or you need a more door-through-door kind of service, that is where our specialty transportation options will come. We also have 2 taxi cab companies that are part of our program. And so just think of that traditional taxi cab service. We also have a volunteer driver program, which is available, but takes a little longer to book out. And then we also have public transportation. So you can see the rides feed. So if you are looking to book or have a ride, but you're near a bus route, that will show up for you in your search options. So we have quite a bit of options through our program. Varies in, service, pricing, and the availability in terms of booking out. So as I mentioned before, that while this program is focused on adults age 50 plus and underserved individuals, it is open to all people of all ages. AARP membership is not required, and training is available for everyone. So I like to tell people that I could go ahead and book a ride right now, even though I am not 50 plus, and I do not have an AARP membership. So the reason why I'm here telling you about this program is that right now we are offering a free Rides for Vets promotion. And so that promotion has started. It started in the beginning of September and will be going through the end of November. And so this free Rides for Vets is unlimited free rides. And so as long as the ride begins or ends in Washtenaw County, the ride can be used for any reason. So if you're going to, look into your insurance options, or going to the VA, or you are trying to go to your local Legion, or you're trying to go grocery shopping, whatever reason you have, you can use this program, and it is unlimited for veterans, and there is no cost associated with it. So the next slide is how you can book a ride. So you can call this number 877-323-0357 and use the code RIDES for vets. And rides can be booked by you or for someone you love. If you are, you have a veteran in your life who would need a ride. Rides can be booked up to 2 weeks in advance. We're not going too further out just because there is an influx of rides. But if you know that you have rides set up that you want to get in the calendar and booked, you can give us a call right then. And like I said before, this program is unlimited free rides for veterans for any reason that you may have. So this is my contact information. So if you do have any questions, feel free to reach out to me. Like I said, I am the Community Development Manager for Washtenaw County, so I will be able to answer any questions about this promotion or any other questions you have about the program. And thank you so much for having me here. And thank you again to our veterans and your service and sacrifice.
Thank you so much, Rebecca. And, like I said earlier in this conversation, we really planned this program around open enrollment. But I think it's important to note, as you stated in your presentation, that these rides can be to your social outlet. If you need to go to, one of your American Legion or whatever that might be, it can be going grocery shopping. We want to make sure that you utilize these rides to the best of your ability and what you want to get out of this. So 100% free rides, and the dates of when they start are right now till when?
Till the end of November, so November 30th. Your last ride must happen on November 30th.
Great. Right before open enrollment ends. December 1st, I believe that date is, but we'll get back to MMAP to get that answer confirmed. But now we're going to open up for Q&A. For everybody that's been on this conversation today, it is interactive at this point. So we want to make sure that we are engaging you, getting your questions answered. Again, you have somebody from the Michigan Medicaid Assistance Program, you have a healthcare expert with veterans benefits, you have the Rides at 50 Plus program, and then you also have the VA. And this is such a great opportunity. So we're going to go ahead and take a few questions that we already have. And I think this one would be for Brenda first, but how do you qualify for VA benefits? If you're unfamiliar with this whole world and you don't know where to begin, where do I begin?
You can qualify for VA benefits, sign up for the VA one of two ways. You can either go online to, I am getting that at www.va.gov, and you can fill out the online application there, or you can come directly to the Ann Arbor VA and you can sign up at our Welcome Center, and they will register you. If you are coming into the VA, just a few things that will come in handy and make it a more streamlined registration. Bring your income information from last year, including any paid out-of-pocket medical expenses. You don't have to have the receipts, just know about how much you paid last year out of pocket. Bring your DD-214 and bring your driver's license. If you are married, bring your spouse's information as well. They include her income in your income information, and they also include her or his, I should say. They also include their paid out-of-pocket medical expenses. And there's other questions that they will ask, but the must-haves would be income, paid out-of-pocket, DD-214, and your driver's license. That will streamline the process if you're doing it in person.
Great. And I'm just going to have one more follow-up question. Oh, I'm sorry, David, go ahead.
Well, I just want to reinforce what Brenda said. You know, we've got to be our best advocate as a veteran, or a family member of a veteran can advocate for them if they can't speak for themselves. But we've got to be able to have those critical pieces of information. Again, this DD 214 is a critical document, and it's a funny title, you know, DD 214, but it's gold. It really makes a huge difference. And then the other information that Brenda mentioned as well, having a driver's license, having expenses, and so forth, are very important things to have. But just remember, and that's why we put together the Navigator, and it points to having the information that is critical for us to be able to be our own best advocates. Unless you can advocate for yourself as a veteran, you can't get your benefits. You've got to be able to put your information out there, and then the VA will go a long ways to help you. They are your friend. Brenda is showing that very clearly, but they can't help you unless you have the information that they need to have to demonstrate what your benefits will be.
That is a great point, David. And one thing I want to add on to that is that you don't know what you don't know. And that's why we're having this conversation today, to really heighten people's understanding of what their benefits look like through all these different services that are available to them, and really showing how they could interplay together. I think that's such an important component. And David, you and I have chatted offline about this too, is that, you know, you might be a veteran who needs some caregiving. And one of the hardest things that we face is that a lot of caregivers aren't self-identifying themselves as a caregiver. They'll make comments such as, oh, I'm just taking dad to his appointment. I'm just taking mom to her appointment. Well, if you're driving your parents to an appointment, that's caregiving. If you're organizing medication after your long day at work for your parents, that's caregiving. If you are making meals or folding laundry or doing any of these things, that's caregiving. And so back to Rebecca, you know, we talk about driving family members to appointments, and a typical caregiver is somebody who's 40 years old and giving over 40 hours of care to a loved one. And the thing about veteran and military caregivers is that you most likely will start earlier on as a caregiver for your loved one, and you'll be in it longer than most caregivers too. So if you could just talk again about this free ride program, I think this is such an awesome opportunity for individuals to really utilize this. And the component that I liked is that you can schedule a ride for somebody else, which really takes away that pressure for that caregiver. So if you could just talk about that again for us, please.
Absolutely. So one of the core parts of this program is that you can book the ride yourself, but if you are a caregiver for someone, you can book the ride on behalf of them. And so you can know and trust that we will pick them up, that we will make sure that they get where they need to go, and they will get there safely and with no problems at all. So we have a special process. So if you are booking on behalf of someone, we'll ask those proper questions, we'll get their contact information, and you'll get that confirmation code. And so for this program, this free rides for vets, you are still able to do that and call on behalf of that veteran.
I love that, Rebecca. I think that's such a great program. I'm old enough to remember when veterans weren't treated really well. I'm talking about the Vietnam veterans.
Yep.
And it wasn't a cool thing to be a veteran. People didn't walk around saying, thank you for your service. Mm-hmm. They were spitting on us and saying, why didn't you go to Canada or something like that during the Vietnam crisis, and to see the kind of outpouring of concern and positive regard that people have here. And so and this RideShare program is critically important.
Absolutely. And I just wanted to add a little history of why AARP got involved with working with veterans is that we saw a need. The Michigan Veterans Affairs Agency, who's not on this virtual call with us today, but a great resource for you, has a toll-free number that you can contact. And if you have trouble getting your DD-214 or need to know exactly what type of documents you need to take to a veteran service officers, you can talk to them and you'll talk to a live person who's going to be answering your questions for you. And that telephone number is 1-800-MISH-VET. And the numbers for that are 1-800-642-4838. But I wanted to share that the reason that, we came to be doing veterans work is because the Michigan Veterans Affairs Agency came to AARP and they said, we know a lot of your members are veterans. And that is so true. Over 620,000 Michigan residents are veterans here in our great state. And we want to make sure that we're giving back to that community. And we learned very quickly from the Michigan Veterans Affairs Agency that these individuals, these veterans, were not collecting on these earned benefits that they received, whether it be a spousal pension, a burial benefit, healthcare benefits, and other benefits that could be financially important to you. And so we wanted to make sure that we started reaching out to our veteran population. And now we're seeing many states across our great country doing this veteran work and making sure that we are giving back because you did sacrifice and you did serve. And we want to say thank you. And this is the best way that we know how to do that. I do want to go back to Melissa really quick about open enrollment, and I may have messed up on those dates on when open enrollment is. So I need you to clarify that first and foremost. And I have a follow-up question with you is about making appointments and talking to a live counselor. Are these done virtually? Are you doing in-person conversations now?
Yeah, so we are in person. We're eligible. Some places are opening up a little bit more than others, so we're kind of at the mercy of those folks. But as much as we can be in person, we are trying to be in person. We do also still have those Zoom capabilities, so we can do Zoom appointments with everyone. We can also do phone call counseling appointments too with folks. And open enrollment is December 15th. I'm sorry, I was saying the wrong month now too. October.
Blame. I take blame. Go ahead.
That's okay. It's the same name, Melissa.
Yes.
October 15th through December 7th every year. Unless for some reason CMS changes it on us, it is October 15th through December 7th every year. And then if you have a Medicare Advantage plan effective January 1st each year, then you can utilize the Medicare Advantage open enrollment period. And that is January 1st through March 30 days, that's September, June, November, 31st. And you can make a change to your Medicare Advantage coverage at that point as well. So a couple different opportunities outside of just special enrollment periods and general enrollment periods.
That's great. And again, we're always really hyper focused on that caregiver as well. So I'm assuming if you wanted to bring in somebody who can help you kind of navigate these things when you're talking to a counselor, you accommodate that as well.
Absolutely. Yes. We can have, two-way, three-way calls. We can do Zoom appointments with multiple people on. And if you want to bring someone with you to an appointment, as long as you're giving permission for them to be there with you, absolutely okay to talk with them. And we do work with folks who have guardianship or power of attorney papers as well all the time. We are sourced out of the Area Agency on Aging. So all sorts of programs available to those that are 65 and older for sure.
Perfect. And then back to Brenda again, because I think people have a lot of questions about the VA and how your system works. I just wanted to ask, you had mentioned that you have around 3 veteran service officers on site and then a patient advocate on site. If somebody does want to go into the VA prior to their healthcare appointment just to get more information, do they have to make appointments for the veteran service officer or the patient advocate?
No, there's no appointment required for any of the services down at our Welcome Center. The veteran service officers, they do take appointments, but they also take walk-ins. If there is a certain organization that you want to see, they all have cards outside their door if they are not on site when you come in. you're more than welcome to take a card with you, make a telephone call. They will call you back and let them know when they're going to be in the office. And we do have at least one patient advocate on site at all times. The patient advocates are more for if you have a complaint about any issues with any part of your healthcare, whether it be from the very start for registration or all the way through your appointments and issues on your provider. And the patient advocates kind of act as the buffer between the patient and that issue. But neither one of them require any appointments. Veteran service officers are typically in the office more than we are. Some of them start as early as 7 a.m. and they go to beyond 5 p.m. How do I know this? Some days I'm leaving at 6 and the veteran service officers are still there. The patient advocates, though, they do have strict hours, Monday through Friday, 8:30 a.m. until 3:30 p.m. It gives them an extra hour and a half to get through all the paperwork that they have to do and to answer responses from all of the veteran complaints that they had received. And they do take compliments as well.
That's important. They are doing a great service to our veterans. I've had events where we had a veteran service officer on site, and this gentleman was in the artillery and had hearing loss and realized that he could receive hearing aids from the VA because of his connected disability. So ask questions, reach out to these resources that we have given you. I do want to wrap this conversation up with just final comments from all of our speakers. One last push for resources or information that you want to share with our audience today. So David, I'm going to start with you.
Sure. It's been a great pleasure to be part of this presentation, Mel, and thank you for everybody, Brenda, Rebecca, and Melissa. This is critical information, and there, as we've already said, there are a whole lot of people that never imagined that the VA might be a place that they could go to get health care or other benefits, whether it's an interest-free loan or cemetery services or, a whole range of different things. But you've got to be your best advocate. You've got to really be able to say, all right, I was in, we're getting a lot of advertisements these days around the Camp Lejeune time frame, and you've seen that on the television and in the news and so forth. But you've got to be able to say, all right, I was in Vietnam, I was in Afghanistan, I was in Iraq. And these are the symptoms that I'm now experiencing. And then, as Brenda said, go to the veteran service officer, tell them what you know, tell them what the concerns are, and they will advocate for you. And just be the person that be that squeaky wheel, because it's critically important. Congress has authorized and appropriated hundreds of billions of dollars every year for the whole purpose of taking care of our veterans, and we need to go after them. There is, I'll just mention one other thing. There is a new Center for Women Veterans, and a lot of people don't think of women being veterans these days, but an increasing number of the veterans are women, and there is a Center for Women Veterans that is very engaged in women's issues. And I don't know if Brenda wants to say any more about that, but there's a lot of reasons to advocate for people that you wouldn't necessarily think would be eligible for services.
Yep, David. And one thing that I've learned over the course of my 22 years at the VA is the VA is always trying to improve, to bring more and more services to their veterans. One of the things that they are working on, and it should be finished very soon, is a new center just for women veterans. I'm not quite sure yet if they're going to do mammograms here on site or not, but if you are enrolled here and a woman or a man and require a mammogram, we do send you out into the private sector. The VA pays for that. And then you can still get your annual screenings done every year. You can be dual enrolled. You can come to the VA for a primary care visit once a year and still see your private sector doctor who you've been dealing with and love. There's no rule that says you have to strictly come to the VA. And Mel brought up one issue as well with those veterans that now have hearing loss. Another benefit to the VA, which I completely forgot to mention, is if you have to have hearing aids, at most, it's going to cost you two $50 copay charges, one for the initial hearing test, another for the test when the hearing aids come in. Those hearing aids are considered prosthetic items, and none of our veterans, no matter what priority group, pay for any prosthetic items. So that's just another small veteran benefit and another way for us to say thank you for everything that you've sacrificed so that we don't have to go through a lot of the issues that other parts of the world are going through.
That's awesome. And Brenda, anything in general you want to talk about, or are you feeling good about the statements that you've made?
I'm feeling pretty good. Like I said, I have staff available until at least 3 p.m. every day, Monday through Friday. If they have any questions, they can stop by in the Welcome Center and just tell the person that's manning the desk they want to talk to somebody in billing. We'd be happy to answer their questions.
Great. Thank you so much. And then
You're
on
welcome.
to Melissa with MMAP.
Yeah, so just a reiteration, our open enrollment season is approaching us very quickly. So October 15th through December 7th, give us a call at our 800 number, that 800-803-7174 number. It connects you and routes you based off of your area code. So if you aren't in, my region, which is Southeast Michigan 1B, but maybe you're up north, it'll connect you with MAP up north. And we are happy to assist. Again, our services are free, they're confidential, they're unbiased, and we aren't going to put you in a position where you have to make a decision between an insecurity, whether, again, it's food or home and insurance. We will make sure to help you find what you need and get you enrolled with all of the programs that you're eligible for.
Awesome. Thank you, Melissa. And then again, as I keep saying, last but certainly not least, Rebecca.
Yeah, so I would just say that even if you are unsure whether or not you are ready to book a ride, but you want to learn more, feel free to use that number to call one of our Community Operations Support Center team members, and they will help you understand kind of the, address any questions that you may have, give you kind of an estimate of what the ride would look like or what providers there are for that ride. And it is a really great program. You can use it for, like I said, any reason now through November 30th. And we really want to serve our veterans.
So I have a question, Rebecca. Can I get a ride that ends in Washtenaw County? I'm in North Carolina.
Well, I'm not sure
David,
if the ride
it's
will
gotta
go
start.
on there, but
You got to start in Washtenaw County.
I don't know if you want to come here, David. It's going to be 46 on Friday. So you might want to stay where you're at.
I'll hang on for now.
Well, I want to thank all of our amazing panelists today for being with us and sharing all of this information. I hope that each and every one of you is walking away with a better understanding of how you can be a patient advocate for yourself and understanding how all of these different benefits, either that you've earned through your service or you choose yourself through Medicare plans, all connect together or not. So that puzzle is always going to be there, but we're hoping that this event really helped you put a few of those pieces together. And then also, again, free rides for veterans. Come on, this is a great resource for you. Up till November 30th. So please utilize this amazing program that AARP is happy to bring to you. This is such a great collaboration of minds and areas of interest. And so please walk away with some good commentary today. I also just want to share briefly all of the resources that AARP is bringing to you. We really focus on your health, self, and wealth. And so we want to make sure that you are living your best life. And we are having programs like this constantly. So please always go to aarp.org/MI to find out other programs. They may not be veteran focused. They could be something about a drumming circle to get you active and having fun. Most of our conversations are happening virtually, but we're hoping in 2023 we're going to get back into community a lot more. I also want to share with you the aarp.org veterans website, where we're talking about, David had shared that there was a gentleman who was 52 and lost his job. We have a job site program where we're educating individuals on how to write a resume. We have job centers where you can apply for jobs. We also do stuff with spouses too. So if you're looking to get back into that workforce, please utilize that program. We're also talking about fraud prevention. Veterans are a major target for fraud, and we want to make sure that you are saving your money and all that money that you have, that nest egg that you've really protected for this whole time, that you go to our Watchdog fraud book. And then last but again not least, our great partnership with the Elizabeth Dole Foundation on caregiving resources. It's a large document that goes through all the questions about how to become a caregiver, what you need to prepare to caregive, just the different forms that you need, the information you have to have, and then talks about mental health of a caregiver. That's a very important component of this too. So we want you to walk away with this knowing that AARP is a loyal friend of yours, that we want to give back to you in some capacity. And this is the best way that we know how to thank you for your sacrifice and your service. And we hope that you have enjoyed this program, that you come back to learn more with AARP Michigan. Thank you all again, and thank you to the panelists again. And I hope that you all have an incredible rest of your day.
Thank you for having us.
Thank you.
Thank you.